What is cholesterol? There are numerous types of fats that we ingest in our diet and our liver and our body produces. And there are good and there are bad cholesterols. We like to have the protective cholesterol, which is called the HDL. The HDL actually, it takes the plaque out of the body, so we want to have that. It's a very protective cholesterol. On the other hand, the bad cholesterol, the LDL, especially what sits on top of the LDL, which is called ApoB, puts that cholesterol into our blood vessels and starts the process of atherosclerosis.
If something starts off and irritates a vascular bed, something like cigarettes, for example, that can cause an injury to the vascular bed, or high blood pressure, which can cause irritation. The bad cholesterol in our system can start to get into that area and start to form plaque.
If you ask, would a patient have any symptoms of high cholesterol? I'm yet to see one. You probably could have a cholesterol of 500 and not even know about it.
Go to your physician twice a year and get your cholesterol checked, because one can be surprised. There's a certain hereditary component that can increase one's cholesterol regardless of what your diet is.
What steps can you take to lower your cholesterol? The first thing is diet. That's absolutely the first thing. Even before you get to exercise,
stick to vegetables, chicken, fish, lean meat.
Avoiding those foods that are rich in its saturated fats, marbleized meats, and dairy and whole dairy products.
Something that I tell my patients quite often of high cholesterol is substitute one meal with just a salad. That tends to work very well for high cholesterol. And then, as time permits, if you can figure out 30 to 45 minutes in your day to exercise, even a regular walk would be sufficient. That will help to reduce your cholesterol.
But in many circumstances, it's not possible to get it low enough, so we have to supplement it with medications.
We take charge, we take control of what we eat, we take control of doing some exercise, but if our cholesterol is not where it needs to be, we need to be on appropriate medication.
That does not mean by default that you're stuck with the medication and that's something you need to take for the rest of your life. Very often, we are able to have a patient who has high cholesterol. You prescribe them a good diet, a good exercise regimen. Check the cholesterol after 6 months. A lot of time it goes down. If not, they might need a very low dose of statin, a medication. And again, after 1 year, you can reevaluate and see if now they are candidates to get off the medication, and they might be able to get off it.
Take the pledge.
Take the pledge.
Take the MedStar Health Million Hearts Pledge.